Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. In a recent interview with Piers Morgan, former White House coronavirus response coordinator under President Trump, Dr. Deborah Birx, admitted that government officials knew early on in the pandemic that the vaccine didn't prevent people from getting infected. However, Birx was responsible for many of the mandates and promoted the claim that the nation needed to achieve herd immunity with a high vaccination rate. She knew it didn't work. If the shots don't prevent infection, how in the world are we going to achieve herd immunity, and what is the point of the mandates? Absolute total control, of course. Greed and corruption at their finest. Birx has been called, quote, the face of COVID, end quote, and was instrumental in mandates like masking, social distancing, and isolation. In December 2020, she maintained that the general U.S. population could only achieve herd immunity if 70 to 80% take the mRNA shots. What she neglected to mention is that we would have achieved herd immunity regardless. Don't need shots for that. That's just what happens naturally. In the interview, however, she told Morgan that the mandates were a result of miscommunication. Oh, yes, of course. I could see how that happened. She's weaving a more tangled web. She explained that the health agencies, not her, the health agencies, she keeps this very vague without mentioning any names, are responsible for increased vaccine hesitancy because of their mistakes, not hers. Throwing the health agencies under the bus when the orders came from her. However, Birx told Piers Morgan that the vaccine was never designed to protect against infection, a fact that was censored as a quote-unquote dangerous conspiracy theory at the time, and that public health agencies failed by not explaining the vaccines well enough to the American public, because, we're not too bright. But here's the thing, though. If it doesn't stop infection, then it's not a vaccine. Quote, what we've done wrong in public health is we didn't explain that COVID vaccines were nothing like the childhood vaccines, and that the childhood vaccines, like many of the diseases, you get it once, you don't get it again, and this is getting the children to have that disease without getting the deadly consequences. That is not what the COVID vaccine was designed to do. It wasn't designed against infection, end quote. Wow. Wow, wow. Not designed against infection, but you mandated it. Yeah. So how do you remedy this conundrum? If it doesn't stop infection, it's not a vaccine. Of course, let's use an old tactic that was used by one of our former presidents. Let's just redefine the word. That worked for President Clinton, didn't it? Let's also label anyone who has the audacity to have a different opinion a conspiracy theorist and a spreader of disinformation. Family relationships and friendships were shattered over this. Many of us deserve a long overdue apology, myself included, and many at AFLDS. But unfortunately will never come because people hate admitting that they were wrong. How are Dr. Birx, Fauci, and numerous others still running around free? They committed crimes against humanity and the American public deserves justice. Ladies and gentlemen, only the truth will set you free. That's why we emphasize that. Stay tuned for the next Daily Dose.